In this tutorial, I'll be looking at a comprehensive list that was actually organized by the World Health Organization. And in this comprehensive list, we'll be looking at the classification of bone tumors. All right. So the World Health Organization actually sat down to classify bone tumors. Right. So like the bone composed of so many elements. All right. It could be the fibrous tissue. It could be the bone cells. Okay, it could be so many. It could be the bone marrow. Do you understand? All right. So now, bone tumors too can actually lead to cancer. All right. So now you could get to see that from the list, many bone tumors at the level of a tumor when they are benign. Okay, they have a different name, and when they become cancerous, and that's basically becoming malignant, they also have a different name. Okay, so now we'll be looking at a comprehensive list talking about bone tumors. All right, their classification. So, guys, our focus today is to talk about classification of bone tumors. All right, so now you can see this is a healthy bone, and you can see this is a cancerous bone. A cancerous bone, you have an abnormal group of cells growing in the bone. All right, it could be inside the bone or by the side of the bone. All right, and these cells are just growing without control. They are growing without a growth regulation or anything. Do you understand? Right? They could call them osteosarcoma, sorry, osteosarcoma, right? That means like cancer of the bone, all right? Now, let's just have an overview before we come to this list, all right? We said that a mass of unusual cell growing in the bone, okay, is basically what we call a bone tumor. Okay, so now most bone tumors aren't cancerous, all right? Some can be benign, okay, and can be treated at that earlier stage if they had been discovered. Then we said our causes of bone tumors include abnormal healing of an injury. It could be that you had an injury, there was an abnormal healing, and it led to the tumor. Okay, it could be inherited conditions, or you could actually get it from radiotherapy. Maybe you have undergone series of CT scans, series of X-rays, series of PET scans, series of SPECT scans. Do you understand? It can actually result in all these bone tumors, right? So now they can also be caused by bone cancer or another cancer that has spread to the bone from other parts of the body. Cancers, one of their main characteristics is actually their ability to spread to other parts of the body. So if you have a cancer that is near the bone and you don't actually treat it, if left untreated, this cancer can actually spread to the bone. Right. So now, guys, we said that we'll be looking at the classification of bone tumors, uh, modified after revised WHO classification. All right, basically done by Strajowitz in 1994, and this is still valid up to today. All right, so now this bone tumor, okay, under this now, this will be the tissue. That column is for tissue, and we'll be seeing the name of the tumor if it is benign. Okay, then we'll be seeing the name of the tumor if it has gone malignant. Do you understand? So now, if there's a cancer that is related to bone formation, okay, if there's a cancer that is affecting bone formation, maybe bone formation from primitive bone cells as an osteoclast, okay, if the cancer is still in its benign, or how will I say it, if the tumor, not cancer, right, mostly it's the malignant one that will call a cancer. If the tumor is still at its benign state, we can call it osteoma, or we could call it osteoma, or you could call it osteoblastoma. Do you understand? But if the tumor has gone to the malignant state, that's when it has become a cancer, you could call it osteosarcoma. All right, and we have an image for osteosarcoma here, right? Osteosarcoma broadly written. Okay, so now this osteosarcoma is into different types. It could be central, it could be peripheral, it could be parosteal. Okay, do you understand? So now moving to the cartilage now, we said that if it is cartilage formation, if it is a tumor that's affecting cartilage formation, we can call it chondroma. Chondroma, that's an abnormal growth of cartilage, right? I have a video differentiating chondroma and osteo, osteosarcoma. Yeah, I have a video on that. So if it is cartilage formation and the tumor is still at its benign state, you could say that it is chondroma. You can also call it osteochondroma. That maybe it is affecting cartilages that are supposed to form bones. That's also like osteochondroma. Then we have chondroblastoma. Then we have chondromyxoid fibroma. Do you understand? Then if the tumor has gone to the cancerous state, or if it has gone to the malignant state, we can call it what? Chondrosarcoma. That means it is cancer of the cartilage. Alright? Then cancer of the cartilage have subcategories. It could be central chondrosarcoma, it could be peripheral, it could be juxtacortical, it could be clear cell, and it could be mesenchymal. Do you understand? Then moving on to the fibrous tissue. Sorry, I meant to actually cycle that up. Fibrous tissue, the benign, if the fibrous tissue is still in a benign form, we call it fibroma, or you could call it fibromatosis. Okay, but if it has gone to the malignant state, we call it fibrosarcoma. All right, then if it is a mixed cancer, basically just call it a chondromyxoid fibroma. Okay, then how about any tumor that is affecting the giant cells? That's the giant cells tumor. If it is still at the benign state, you call it benign osteoclastoma. That's the tumor that is affecting, or how will I put it? The tumor that is affecting the primordial cells, okay? That's the osteoclasts, the ones that are actually meant to come and form bones later. So if a tumor is arresting these cells at the younger stage, it is called benign osteoclastoma, okay? But if it has gone malignant, you call it malignant osteoclastoma, all right? Then we have bone marrow tumors, and bone marrow tumors are basically malignant, okay? But they basically show up in the malignant. You don't really have them in benign states, okay? So we have two categories. We have the Ewing's tumor and we have the myeloma. Okay. Then how about the vascular tissue? That's any tumor of the bone that is also affecting the blood vessels in the bone. If it is at the benign state, you call it hemangioma, or you could call it hemangiopericytoma, or you could call it hemangioendothelioma. Okay? Then if it has gone to the malignant state, you can call it what? Angiosarcoma. You can call it malignant hemangiopericytoma. All right. Then other connective tissues in the bone, if it is at the benign state, you have it at fibroma, fibrous histiocytoma. You could call it lipoma. Okay. Then at the malignant state, you could have it as fibrosarcoma. You could have it as malignant fibrous histiocytoma. Then you could have liposarcoma. All right. Then other tumors that can actually affect the bone, uh, if it is affecting the nerves generally, okay, you call it neurofibroma or neurorelemoma. Okay, that's if it is affecting the neurolemma, okay, or neurofibroma, it is affecting the fibrous tissues of the nerves, okay. Then if it has gone to the malignant state, you call it adamantinoma, right? Sorry, I cancelled that out. Then you can also call it chordoma. All right. So looking at this is basically the classification of bone tumors according to the World Health Organization. All right. And this was done in 1994 and is still valid up to date. Okay. So you could see this is osteochondroma. All right. We spoke about osteochondroma here, which is a benign uh, tumor of the cartilage, right? Well, I told you guys that it's an abnormal growth of the cartilage. All right, so you could see this is a peristeal chondroma. You could see this is a osteosarcoma. You could see this is a chondroblastoma. All right, so guys, this image actually contains everything that we spoke about here. All right, so restart this video, go back, screenshot this, all right, then go back, screenshot this image, all right, and when you look at any word, try to like check it out, all right. You can see the Ewing's sarcoma here, all right. You can see the fibrous dysplasia, you can see the adamantinoma, all right. So guys, this image is very, very, very important, all right. But for the sake of not doing a long lecture, I'll just let it for you guys. So screenshot and screenshot and get to compare them. All right. So bye for now.